A question we're often asked is, can traumatic experiences impact siblings differently even if they experience the same thing? Let's take a look. A common question by parents, carers and practitioners is, can siblings who grew up in the same household, who experience the same events, be impacted differently by those events? Is trauma impact always the same, or can it be different for different siblings?
Many of the siblings we support have grown up in the same household and have experienced similar things within that household environment. These experiences can include nurturing experiences, but also experiences that are classed as adverse childhood experiences and are often traumatic. These can be things like domestic violence, neglect, abuse, or other forms of household dysfunction. Experiences which will have impacted a child and can often impact them negatively. But the question is that impact always the same for all siblings in the household?
The answer to that is no. Siblings can be impacted differently even though they've experienced the same traumatic events. There's several reasons why trauma impact will be different between different siblings, even though they've had the same experiences.
Let's take a look at the experience of our two siblings who often help us out with these videos, Joe and Ruby. Let's imagine Joe and Ruby grew up in a household where they experienced neglect and domestic violence. Joe is 4 years older than Ruby. For the first 3 years of Joe's life, things were fairly stable at home. Joe and his mum lived with Joe's gran, and she helped Joe's mum care for him. Joe had enough food, was kept warm, and he had people around who would play and interact with him. When Joe was 3 years old, he and his mum moved in with Joe's dad.
When thinking about possible trauma impact on siblings, it's important to consider the individual sibling. We need to look at both their nurturing experiences and the traumatic experiences they've had. In this example, as far as we can see, Joe has had 3 years of nurturing care. That will have given him a positive foundation that will have supported his development in a number of areas.
When Joe was 3, before Ruby was born, his mum and his dad started to argue. They would shout at each other and sometimes hit out at each other. This was scary for Joe. This would be classed as a traumatic experience. Ruby was born a few months after this arguing started. After Ruby was born, Joe's mum's time was spread between 2 children, and she found it more difficult to look after both Joe and Ruby. There were times when Joe and Ruby didn't have enough food, they weren't warm enough, and they weren't played with. This was an experience that worried Joe and made him feel helpless. It also impacted Ruby, who was still a baby. This was another traumatic experience. The fighting also continued during this time, so Ruby experienced this fighting when she was just a small baby.
Joe and Ruby are 2 siblings who've experienced the same traumatic events, domestic violence and neglect. But there's a high likelihood they'll have been impacted differently by those events.
Firstly, Joe and Ruby are different ages when they have these traumatic experiences. Joe is age 3 when they start, but Ruby's experiences will have started pre-birth. Their age when these experiences happened will be a contributing factor to them interpreting these experiences differently. Joe, who's experienced a nurturing environment, will wonder what's now wrong. He's likely to experience anxiety and worry as he has some understanding of how things should be and that something isn't quite right. Ruby hasn't had a period in her life where she hasn't had these traumatic experiences. For her, they may seem like the norm because it's all she knows.
Secondly, we need to remember that the age of the child when traumatic experiences happen plays a much larger role than just in how they interpret the events themselves.
There are key times within a child's life when crucial development is taking place. If traumatic experiences happen during these key times, the impact of traumatic experiences is likely to be a lot greater, impacting on if a child meets developmental milestones. In this example, without any other intervention, the impact on Ruby may be different than the impact on Jo, because these traumatic experiences may overlap with her early life development.
Thirdly, we need to consider protective factors. Are there any protective factors that protect the child in some way from the full impact of those traumatic experiences?
Protective factors can be a range of things, such as having a close family member, like a grandparent, that provides nurture and support, a school that provides a safe environment, or that a child's development might be on track, providing them with essential skills to be able to cope with traumatic situations. A sibling can also be a protective factor for another sibling by providing them with care or protection at traumatic times. This is often the reality of traumatic situations for siblings.
To summarise, siblings who grow up in the same household and have the same traumatic experiences are more often than not impacted differently by those experiences. This includes long-term traumatic experiences like the ones in this example, but also one-off traumatic experiences as well. Here's one final trauma-informed care top tip. The impact of childhood trauma might be completely different across siblings within a sibling group, but sibling relationships as a whole have shown to support with childhood trauma recovery. Sibling relationships can help with social skills, attachment, peer relationships, and overall resilience. So the more we can support them and the more we can support siblings to support each other, the better they'll be able to recover from childhood trauma. So we'd recommend as our top tip, always supporting that sibling interaction and those sibling relationships. For more information on childhood trauma and trauma-informed care, subscribe to Tribe for trauma-informed care in practice.